Hello, my name is Jorge. I would like to thank the INCB for convening this thematic hearing on the young people and drugs, and to the Vienna NGO Committee for giving me the opportunity to send this video. As I said, my name is Jorge. I am currently living in Mexico City. I have been advocating for a drug policy reform during the last 6 years, and I have an organization named Instituto RIA, promoting research and innovations on drug policies that work. The foundations of the international drug control system are laid on the assumption that a prohibitionist paradigm will prevent people, especially the youth, from accessing and using drugs as a means to promote public health. However, data suggests show that the prohibitionist regime has not prevented either the distribution of drugs for young people nor the recruitment from criminal organizations to participate in drug trade and other illegal activities, nor the deaths caused by disinformation around issues related with drugs. In fact, a punitive approach on drug policy has disproportionately affected young people who use drugs. Indicators on the effectiveness of drug policies have focused too much on law enforcement and the prevalence of drug use, and too little on human rights and the reduction of risks. Current drug control policies have created unintended outcomes such as the enlargement of an illegal market that is recruiting people from vulnerable groups, certainly young people, to participate in criminal activities, the lack of access to substances for people who need them, and numerous human rights violations, mainly because of militarization policies. When a young person is provided a life choice of either being a rural farmer or forming part of an organized criminal group where they are given resources, perceived power, and also protection, it is not much of a choice. Governments have to offer something better. International drug policy has failed in its own objectives, considering that drug use among young people has not decreased since the UN conventions were convened, but their participation in illegal activities related with drugs has increased, as well as our criminalization. Alternative responses have emerged from specific countries and civil society organizations to promote human rights and social welfare for vulnerable groups, implementing strategies that have proven to repair some of the social and economic harms of current policies. During the last years, Uruguay, Canada, and 9 states in the United States implemented an alternative approach to the cannabis market by regulating the cultivation, production, and distribution of the plant from the seed to the final user. Access is granted for adults 18 or 21 years old, respectively, for personal use. Countries are collecting taxes from the sale of this product, and institutions are channeling these and other resources to reduce the related harms on the use of cannabis, mainly by providing evidence-based information. While the regulation of cannabis and other drugs may effectively respond to the world drug problem, harm and risk reduction strategies can strengthen international cooperation. Civil society organizations all around the world have carried out activities to respond to negative consequences of prohibition, such as overdose deaths and social marginalization, by implementing activities like platforms with information on substances and delivering services such as drug checking in nightlife settings, which is a place at festivals or parties where people can bring their drugs. I volunteer at a peer-to-peer program where we chemically analyze if the drug has the presence of other substances, while providing information on suggested doses and other relevant information on drugs. Of course, harm reduction in party settings does not begin and end with drug checking, but also with other measures which help create a safer experience for people who use drugs. In Argentina, for example, the government funds a project run by a civil society organization offering educational flyers, free condoms, and hydration points at festivals and raves in Buenos Aires. In Uruguay, the National Drugs Board funds specialized staff training for harm reduction, awareness-raising campaigns, and hydration points at bars and nightclubs. According to the 2018 report on the global state of harm reduction, Argentina, Brazil, Colombia, Mexico, Paraguay, and Uruguay have implemented harm reduction strategies such as needle syringe exchange programs. And only Colombia, Ecuador, Argentina, and Mexico have implemented opioid substitution therapy programs. As it stands, drug checking services are only available in parts of Colombia, Brazil, Uruguay, and Mexico. The predominance of the international drug control system within the UN drug conventions is increasingly out of step with the UN's far-reaching purpose of promoting solutions to international economic, social, health, and related problems. Recently, the Mexican government included within its national development plan the need to reconsider the war against drugs, noting that the prohibitionist strategy is unsustainable and proposing human-centered drug policies that can be used for promoting economic and social development. During my recent visit to the CND high-level ministerial segment and session, the participation of young people in these spaces was evident, mostly coming from civil society groups. I celebrated the decision to hold this thematic hearing. However, the INCB could push for young voices to have a participation in more spaces, namely by including youth inputs in the drafting of the annual report and ensuring that you meet with youth organizations during your country visits, hearing directly from us. Cannabis regulation and harm and risk reduction programs may be seen as policies that can address the world drug problem while strengthening international cooperation. The drug control regime is not preventing drug use among young people. However, cannabis regulation has given social and economic entrepreneurship opportunities for young people, while creating mechanisms that allow the state to prevent minors from accessing the plant. Along the edge, harm and risk reduction strategies, especially information platforms with doses recommendations and drug purity checking in nightlife settings, have prevented overdose deaths and promoted good and healthy practices related with drug use. The international community should use evidence of the effectiveness of these policies to build institutional capacity based on shared responsibility through coordinated strategies to create human-centered drug policies that comply with the rights of young people. Thank you. I am delighted to answer any questions and keep the conversation going by email. And again, thank you for opening these spaces.